Well, a new Johns Hopkins study is showing that COVID shame is very real. How are you feeling this morning? Are you trying to get through COVID? Well, we can tell you this. 1 in 4 people living in this country do associate the feeling of shame with the virus. That embarrassment and guilt, it's taking a real toll on the mental health of a lot of people living here in our state.
We did get vaccinated. And so me working at home, I figured, okay, I have a lot less exposure.
For nearly 2 years, Angelique Atwell did all she could to avoid COVID-19, mostly staying home for all that time. Then, just before Christmas, she tested positive.
I think there's this weird, stigma about having it. It's like shameful when you have to tell people.
Because of COVID case surge, some who test positive, even after avoiding the virus at all costs, are dealing with something called COVID shame.
People are worried about perceptions of others or feel like they're being blamed or scrutinized or criticized. So I think what we need to do as a community is really just destigmatize that, getting this is an inherently bad thing.
Dr. Emily Basha is a psychologist here in the Valley, offering some perspective to get through a time that might be confusing socially, and especially so with these changing guidelines from the CDC.
Let's make wise and healthy decisions. Let's not blow this out of proportion, but find balance. And so really weighing out the pros and cons of decisions of what we choose to participate in while continuing to communicate with each other and one another and let each other know if we're not feeling well.
Dr. Basha also tells me she hopes those wondering how they got COVID realize a positive test doesn't equal recklessness. And even if you are vaccinated, masking up and social distancing, there are still some risks.
Who have I seen? Who do I need to tell? Where was I without a mask? Who could I have potentially exposed? And so that went through my mind of I really hope that I did not expose anyone.
We're living in just such unique times. So to help ease pandemic anxiety, the number of people taking prescription meds right now in our state alone, it's gone up 20% in the past year. Dr. Basha says those who recognize the need for help should be applauded for their courage to even reach out for it. She also says we need to all stop judging each other and just give ourselves a little grace.